Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
8 health problems that can ruin your child's summer. The summer season is when children are at the highest risk of falling ill. But understanding the risks and preventive measures can help you stay one step ahead. Let's take a look at the most common summer ailments kids are prone to and also how to deal with them. Number 1. Dehydration and sunstroke. When the kids play in the sun outside, continuous exposure can sometimes cause the body temperature to rise abnormally. The water content of the body also falls, and the result is disorientation, nausea and even fainting. What you should do: try to keep the kids indoors when the sun is at its worst. Keep them hydrated with a wide variety of summer coolers. Number 2. Eczema. This chronic skin disease has the tendency to aggravate during summer on account of sweat, exposure to the sun, and increased secretion of oil. What you should do: try and keep your child's skin as free of moisture and sweat as possible. A hypoallergenic sunscreen and moisturizer is your best bet. Number 3. Insect bites. Summer is the hotbed for insect bites of all kinds, which can lead to skin rashes, inflammation, fever and extreme pain. What you should do: teach your kids to stay away from insect-ridden areas and keep exposed skin areas at a minimum. Number 4. Conjunctivitis. There is a fair chance that the viruses causing pink eye can reach your children through dirty hands. This leads to redness, itching and eye inflammation. What you should do: ask your children to avoid touching their face or eyes unnecessarily. If they have contracted the problem, eye drops usually help clear it up in some time. Number 5. Food poisoning and diarrhea. Summer is when kids consume the greatest amounts of street and junk food. If microbes find their way into the digestive tract, they can induce vomiting, diarrhea, abdominal pain and fever. What you should do: the only way to avoid this is to maintain excellent hygiene in the kitchen and consume only fresh, well-cooked food. Number 6. Viral cold and cough. During summer, the air is really dry, and the resistance to infection-causing viruses is low. Viral fever is very common at this time. What you should do: a good amount of rest, plenty of fluids and saline drops are usually sufficient to recover from the ailment. Visit a doctor if the symptoms persist. Number 7. Prickly heat. Too much sweating sometimes blocks the skin pores, which causes raised bumps or prickly heat. What you should do: opt for a chemical-free talcum powder that can ease the condition. Also, dress up your children in loose-fitting cotton clothes as far as possible. Number 8. Swimmer's ear. Post-swimming, if some of the water remains trapped in your child's ear, the moisture can trigger bacterial growth. This leads to itching and severe pain. What you should do: make sure the kids wear earplugs while in the water. If they have been infected, administer an over-the-counter antiseptic ear drop. Now that you are armed with the knowledge of the risks beforehand, we foresee a happy and healthy summer.